That year, 64% of Americans supported a national health insurance plan. Support in the states' rights South, which was heavily Democratic at the time, was even higher than the national average. Seem too good to be true? That's because Truman's proposal would have expanded health coverage through Social Security, which at the time explicitly excluded agricultural and domestic workers. That meant 60% of Black men and 80% of Black women were not eligible for the benefit. However, the push for national health care coincided at a time when challenges to Jim Crow and discriminatory provisions in federal programs like Social Security were also underway. In 1946, Truman established a Civil Rights Committee, which desegregated the military and banned discriminatory hiring practices in the federal government. Southern elites began to link new proposals coming out of Washington with threats to segregation in education, healthcare, and housing. The possibility that a national health plan would desegregate the healthcare system and institute a significant transfer of wealth from whites to Blacks caused Southern support to plummet from 66% in 1945 to only 22% 4 years later. Southern elites were a core constituent of the Democratic Party at the time, and nothing could be passed without them. In 1949, around the time every other wealthy country was moving towards universal health care, the Democratic coalition fractured and Truman's plan in Congress died. In 1964, the NAACP won a landmark Supreme Court case requiring hospitals built with federal funds, which was most of them, to desegregate. A few months later, the Civil Rights Act was passed, reinforcing this mandate. Passage of a true national health plan was still blocked by Southern Democrats in the 60s, since after the Civil Rights Act, this would have meant desegregating the entire healthcare system. So in 1965, the Southern delegation finally came to the table to negotiate the creation of two groundbreaking, yet limited healthcare programs: Medicare, which initially covered only seniors, and Medicaid, a state-run program for certain groups of low-income people. The Dixiecrats ensured that these programs were designed as much as possible around the racial hierarchies in the healthcare system. For example, Medicare is split into two parts. Part A, the part that covers hospital care, requires no premium. Medicare Part B, the part that covers physician care outside of a hospital, does require a premium. Why split Medicare into two parts? Part B was designed this way so that physicians' offices in the South could claim that it was a voluntary insurance program, not a direct government payment, and continued to racially segregate their offices and refuse Black patients. And why was Medicaid created as a federally funded but state-administered plan, while Medicare was administered by the federal government? This compromise allowed Southern states to discriminate against low-income people of color in terms of eligibility as well as benefit levels, and this also dramatically slowed the desegregation of nursing homes. While Jim Crow laws no longer exist, the impact of structural racism on our country's healthcare system has been profound. People of color are still overrepresented in states that have poor safety nets and strict Medicaid eligibility requirements, and new waves of immigrants, particularly Latinx, have fallen into these systems of racial inequity created for African Americans. True national health care, like Medicare for All, was blocked by segregationists during the post-war period when the rest of the developed world was establishing health care as a right. By the 1970s and 80s, a large healthcare industry and lobby had emerged, making passage of national health care more difficult and likely requiring a massive social movement. It's time to atone for this ugly chapter in our history by building that movement and guaranteeing everyone health care from cradle to grave.
Yay.